Hi, I'm Kyle,
I'm Briana.
and we are going to discuss leptomeningeal disease and symptoms. I am not a medical doctor nor a medical professional, and you are.
I am not either, but I am a patient and have been since I was diagnosed with LMD in February of 2018.
So, what we're going to primarily go over is not how to diagnose it, but the symptoms that may occur for somebody who is new, who's never been diagnosed, or even somebody who's had LMD and is stable or had regression and changes in symptoms. So first, what's leptomeningeal disease? I did a basics video some time ago, which I will put a link to below the video or somewhere in this, so you can get more information about leptomeningeal disease, which is a pretty good basic explanation of what it is. But for the purpose of this, it's cancer cells that get into the cerebral spinal fluid and float, and they can coat anywhere that the cerebral spinal fluid or CSF goes. So that could be spinal cord, any of the cranial nerves, in the brain, the meninges, anywhere along the spine. And of course, anything that gets coated will start malfunctioning. That coating can be a thin glaze. It can also be thicker, and that's frequently called nodular leptomeningeal disease. So LMD is what we're going to call it for short. So some of the symptoms are, you can look it up online if you want, but pretty basic across the board. It can be any one or multiple of these. It could be an extreme headache that worsens and does not get better, blurred vision, slurred speech, difficulty swallowing, confusion, dizziness, increased nausea, seizures, numbness of the toes, fingers, or actual loss of function of a limb. Normally it would probably be a lower limb first. It could be bowel problems, such as changes in bowel function. And I'm not talking, hey, I just got constipated today. Now, these are things that would be, if the LMD was progressing, it would be a fairly different change from what you had before. Anybody who's had cancer before, specifically if you have one of the more common types that turns into leptomeningeal disease, which would be melanoma, lung cancer, or various forms of breast cancer, those people in those categories probably need to be more vigilant with paying attention to their symptoms. Now, these symptoms can also be from other things. You can have some spinal injuries that are not related to cancer that cause numbness in the toes or loss of use or change of bowel functions. You can have headaches caused by chemotherapies or by the cancer itself or a medication you're taking. So one of the complexities of leptomeningeal disease is monitoring symptoms. If you suspect leptomeningeal disease is occurring and your symptoms are getting worse, a contrast MRI is really necessary as soon as possible. A lumbar puncture to collect CSF is also really a desired method as well, and often it takes 2 or 3 lumbar punctures to accurately diagnose or rule out. They can also check for other things in the CSF, which we discussed in prior videos as well, so I'm not going to go into that. So with regard to symptoms, they can change. Just because you're an LMD patient, you've been diagnosed, and maybe you're stable, your treatment's working. Leptomeningeal disease is not curable at this time, so there's always a chance of progression. So what happened whenever yours progressed this time? Did you have the same symptoms or different symptoms?
I had different symptoms. I've always had problems swallowing whenever it affected my 6th and 7th cranial nerves, but the swallowing got worse, and my throat got worse, my swallowing, and I could tell something was changing, and it's all related to nerve function. It's kind of insidious in the way that it just kind of changes things a little bit, but noticeably.
So when Briana was first diagnosed with leptomeningeal disease back in 2018, she had had a mild facial droop that had returned. And we were very kind of hyper aware of changes with her because they had suspected leptomeningeal disease several months before, but there was no testing done at that time, and the MRI didn't show it. So that was her first real indication of a symptom. She didn't have a headache. She didn't have increased dizziness. She didn't have anything else except for that facial droop. We also realized later that she had developed some numbness in one of her feet. It actually was the entire bottom of one of her feet, going up through the heel, which we never thought to check for. It just wasn't something discussed because nobody talked to us about leptomeningeal disease or what to look for. So after whole brain radiation, targeted therapy, they never pulled CSF for her, so not until October of 2018 when she got her Maya put in. At this point, her LMD had regressed significantly because of targeted therapy. And she had some symptoms that remained. In 2019, after bouncing between some different treatments, she had progression again. This time, the progression symptoms were different, and we weren't really expecting them. Do you remember what they were? So in 2019, September of 2019, she actually developed a swatch across her torso, across the front, that was numb. It was about a 2-inch swatch that wrapped around her torso, which concerned us, of course. So we started checking to see how far around it went, and it matched up with an area came from her back. She also suddenly developed over a 2-week period slowing of her bowels, like abnormally quickly, where she went from a certain pattern to not being able to go. They did her MRIs and they realized that she was having progression. A couple more months, change of treatment, targeted therapy again, intrathecal IL-2, massive regression, fantastic. Then in 2020, she moved back over to a different intrathecal immunotherapy. This time in October of 2020, she wasn't having any symptoms, but her cerebral spinal fluid every time they dosed was coming back with malignant cells. And this is the first time she consistently had malignant cells. In December, she started having some strange symptoms. We weren't sure what they were. She had a visual disturbance where she was seeing what we called a latent image. I looked it up and I can't remember what it was called, where she would look at something and it would almost like imprint in her vision and she'd look away and it'd still be there. Increased headaches with head movement and visual movement, increased nausea, and it kind of ebbed and flowed a little bit, so we didn't know what to think about that. It continued to worsen into January and February, so they did a repeat MRI and everything was stable. Do you remember some of the visual disturbances you had that were concerning?
I would glance, have my eyes closed, and open them briefly and glance to the side or something and then close them again. And I would see like letters, just a jumble of letters floating in my mind's eye. And one time, that was one time. Another time I saw what looked like a digital TV screen with a bunch of little blocks of, talking heads or whatever you might say, just over here in my upper peripheral vision, just floating there.
Which to us, that's when she had her very first seizure, and only really big seizure back in 2018. Right before her seizure, she had a visual disturbance as well, where she saw she'd been looking at a computer screen and saw something scrolling. Her eyes were closed and she's like, I can't stop the vision from scrolling in my head. It just won't stop. So for her, she always seems to, that was a concern for us, that she was seeing something in her vision. Even when her eyes were closed, she was seeing floating images. So they put her on another seizure medication in February. MRI was clear. And as time progressed, During the same time, headaches were increasing, nausea was increasing, where she was having to lay down every day. So they put her on a secondary seizure medication, thinking she might be having either some type of migraine or an aura from a pre-seizure. She was having her EEG showed some pre-seizure activity, but didn't have a seizure at the time. What we know now is that she was having progression. Even though the MRIs were clear, her CSF continued to show malignant cells, and while they had hoped she was sloughing off dead cancer cells, what turns out is that her cancer was progressing the whole time, but it was not visible on MRI. So what we pay attention to are symptoms, and we have to be hyper vigilant, and every time something new crops up, we bring it up to the doctor and let them do whatever they need to do. And sometimes there's just no way to know if it's progressing until you see it. What are some of the things you do on a day-to-day to monitor your symptoms or track them?
I have a notepad function on my cell phone where I keep track of just kind of daily things, what I eat, my bowel movements, if I exercise or get out in the garden to pick weeds or whatever.
Medication.
Oh yeah, medications definitely.
She tracks her medication, so that way we know if there's any changes in medication that she's done in the past couple days, could that be causing a symptom, and it's not really LMD. We also, if she does any type of, we make sure that she tries to do some exercises so she stays strong. That is basically requested by her oncologist. So that way, if she develops a new pain running down her arm or in her neck, is it from something she did there, or is it a symptom we need to start watching? Those are things she tracks pretty regularly in just a journal on her phone.
And certain treatments can have me bedbound for a few days. So I need to keep up my strength when I feel well enough to do that. So for those instances, whenever I am in bed for a few days at a time, I won't completely go down.
So the point of this video is really just to reiterate, whether you don't have LMD but you're suspected of it, or if you have LMD and you've been stable, please track your symptoms. Only you or your caregiver can be hypervigilant to notice any changes. You're not crazy. You're not insane. These are things you need to be taking care of and watching very, very closely, because even the smallest change could be indication of something neurological changing, and you want to try and get ahead of the LMD before it gets too far along. That is a key to staying on top of this, is monitoring symptoms and having a diary or a journal of some kind, so you can go back and say, wait a second, I didn't have this a week ago and I'm having it every day now. You also need to figure out what needs to be ruled out or not ruled out. Anything else? We've got a phone ringing. Anyway, thanks. This was longer than we wanted it to be, but we hope this helps. Love you guys. Bye.